So one of the values of Clarkson College is that of caring. And in the nursing profession, I feel like we have a really neat opportunity to demonstrate this value on a day-to-day basis, no matter what role we're in, whether we're caring for patients or other staff members or um, other people in our role. So in my nursing career, my opportunities to demonstrate caring has looked different. I started my nursing career out in the cardiac ICU. And as you can imagine, I was able to, walk through some really hard situations with patients and their family members, oftentimes on some of their worst days of their lives. So, having an opportunity to play that role for patients, to show care for them for 12 hours straight was really awesome. And oftentimes consecutive days in a row. But caring for an ICU patient, looked different depending on the situation. Whether it was just showing care to them about their condition, concerned for what's going on, answering their questions, making sure that their needs, every need was met, whether it be, physical needs, emotional needs, spiritual needs, making sure they, get their meals ordered, making sure that, their questions are answered. And then, of course, we had a lot of patients who, weren't able to interact with us because they were intubated and sedated, and, really critically ill. And so showing care for those patients looked different, even more so because, ensuring that they had good hygiene, that they were bathed, that their sheets were clean, that they were, I guess, well situated and comfortable in bed, that they had good oral care done, ensuring those things were done showed care to them, and it showed care for them to their family members. And then a lot of times in those situations, it was almost as much caring for the family too, because of course they would have a lot of questions and concerns, and just helping educate them showed care to them. And so in my current role, I work in the outpatient cardiology clinic, so an ambulatory setting. So, we don't necessarily have patients having these critical situations as often in the outpatient setting. And if they do, of course, they go to the hospital for that. But, we do have patients calling on a day-to-day basis and sending my chart messages with questions and concerns about their condition, about their medications, about, next steps for things. And so one way that I get to show care now is just by taking time with them and answering all their questions to the best of my ability. You know, Not considering any question to be a dumb question, but taking every question seriously is one way that I show care to the patients that I care for now. And just having, compassion on them and trying to put myself in their situation and understand kind of what's driving these questions or these concerns. So taking time with them is one way that I show care now. And I think it's awesome that in every role of nursing, you have an opportunity to care in some way for whoever you're working with in that role.